Altaf Hussain.
Thank you, Presiding Officer. I would like to pay tribute to all the staff working to deliver services in the Cwm Taf Morgannwg Health Board area, not just the medical staff who have shown such resilience in the past 18 months, but to those leading the organization in what has been a challenging time. We know that the board were facing substantial challenges before the onset of the pandemic, and many of the weaknesses in our health services were exposed by COVID-19. Benefiting from higher quality neonatal and maternity service is still a priority of the local community, and I hope the board is focused on this. My questions are, Minister, in your written statement earlier today, you said that there has been loss in momentum because of COVID, but that the program is on the right track to deliver long-term and sustainable improvements. Unless something specific has been done to regain the lost momentum, how is the program on track? Number two, the independent maternity service, oversight panels, thematic stillbirth category report paint a bleak picture. We should be evaluating what women have to say about these services, and this has not been the case. What does this health board and others need to do to listen to the views of women who have been neglected and ignored? My last question, Minister, the oversight of the board is critical. In other spheres, people would have been replaced and the competency of the board under review. What are you doing to ensure that the board is fit for purpose? Thank you very much.
Thanks very much, Altaf. Certainly, I think it's fair to say that there is an understanding, of course, that maternity services are a priority, not just for the local community, but also for the Health Board. It is one of the key areas that is a responsibility for the NHS, is to make sure that babies are delivered safely. Of course, like other services, there has been a loss of momentum as a result of COVID. You wouldn't expect anything else. So it has been knocked off track slightly, but we are very keen to make sure that we do all we can to get things back on track, and that we don't change the need to address the issue of culture within the organisation. And I agree with you that the picture that's painted in the report is bleak. And it is critical that we listen to the views of women who were affected by the services that they had. But I think you make a really fair point in terms of the need for the board of Cwm Taf Morgannwg to take a real interest in this, and that their role in oversight is absolutely critical. And that's why I'm very pleased that Emrys Elias has taken this seriously, that I know he understands the need to really focus on this as an issue. And it's not just this as an issue, but also the broader governance issues that really need to be addressed, particularly within this Health Board.